Hello everyone, today we will discuss the radial nerve and its injury sites. First of all, we will understand the anatomy of the radial nerve and the course the radial nerves goes through while innervating the muscles. Radial nerves originates from the posterior cord, has root valley of C5, C6, C7, C8 and T1. It is posterior to the axillary artery third part and exit the axilla through the triangular interval. At this level, it gives motor supply to the triceps and sensory supply to the posterior arm. Coming downwards, after the exit from the interval, it runs in the radial groove of the posterior surface of the humerus, and following after that it pierces the lateral intermuscular septum and comes anterior to the lateral epicondyle. Here it passes between the brachialis and the brachioradialis. Here it gives motor supply to enconius, brachioradialis and extensor carpi radialis longus and sensory supply to the posterior cutaneous nerve of forearm. Now at the level of the cubital fossa, the radial nerves divides into two parts. First one is the superficial branch and the other is the deep branch. Deep branch is also known as the posterior interosseous nerve. It passes between the two heads of the supinators, also known as the arcade of the frosae, and supplies all the extensors of the forearm, while the superficial radial nerves runs between the below the brachioradialis and above the supinator muscle, and it passes over the anatomical snuff box and supplies the dorsum of the hand. Now coming to the algorithm to identify the site of injury for the radial nerve. So we can easily follow an algorithm. First we have to check the elbow extension. If it is present, if it is absent, then it is a high radial nerve injury. For example, the crutch palsy or Saturday night palsy, or in case of shoulder dislocation. If elbow extension is present, we check the wrist extension. If it is absent, then the injury is at the spiral groove. For example, as in case of the shaft of humerus fracture. If the wrist extension is also present, we go further below and check the finger extension. If it is absent, then the posterior interosseous nerve lesion is present, such as posterior interosseous nerve syndrome, can be due to the compression at the arcade of frosae between the two heads of supinator, or if there is ganglion, or in case of rheumatoid arthritis. If the finger extension is also present, then we check for the sensory loss at the dorsum hand. If it is lost, then there is the superficial radial nerve injury, also known as the Wartenberg syndrome. It can be due to the tight watch strap or handcuffs, or distal radius fracture, or in case of lacerations. We can also check the reflexes to reinforce our diagnosis. If the triceps reflex is absent, it is indicative of axillary lesion. If the brachioradialis reflex is absent, it indicates lesion at the spiral groove. If the both reflexes are present, the lesion is somewhere distal. Thank you.